Hi, I'm Dr. Packer with Precision Spinal Care, and today we're going to talk about choosing the right treatment and doctor. Now, how people heal is the same. It's based on biology and physiology. The provider and the method of care chosen is what is variable. The body heals in three phases: the inflammatory phase, the repair phase, and the remodel phase. What we typically treat through these three phases are neck pain, headaches, low back pain, and injuries as the result of an auto accident. Now, typically, the causes of spinal pain can be specifically tracked to a medical diagnosis about 1 out of 4 times, and that's typically things like compression fractures, spinal stenosis, and disc herniations, just being an example. 75% of the time, chronic related spinal pain is not caused by a specific medical diagnosis that can be determined by a primary care provider, orthopedic doctor, or neurologist. The patient is often told the tests are negative and is left with pain management, usually consisting of over-the-counter medications, prescription painkillers and muscle relaxers, steroids, and pain injections. Now, what's often missed is the spinal ligament injury, and this is just a sample of what a ligament injury looks like. Our clinic uses the AMA guides that can accurately determine if the cause of the spinal ligament damage medically verified with a process known as CRMA, computerized radiographic mensuration analysis, meaning we take an X-ray and we can use a standard medical test to determine if the cause of your pain is indeed coming from damage to the spinal ligament. This is what's known as the misdiagnosis. It's a very common injury with trauma, auto accidents being the #1 cause. We have an AMA medically recognized test of an X-ray and CRMA to verify this diagnosis. Our treatment is designed to treat this very problem. Choosing the right specialist for spinal pain is important. Some examples would be if you had a major disc injury, fractures, medical lesions requiring surgery, the orthopedic MD would be the best specialist. If you were diagnosed with nerve damage or concussion, the neurologist would be the best specialist. However, if you have spinal ligament damage, a NUCA doctor teamed with an MD radiologist would be the most appropriate specialist for treating that problem. Now, we just shown a little illustration here of our trauma algorithm in which we're able to diagnose and determine what is the best treatment and best doctor for your particular problem. We recognize the right specialist for each condition and make the appropriate referrals. Use of a medical team approach is in the best interest of our patients. Now, when your primary care provider, your orthopedic doctor, or neurologist can't identify the source of your spinal pain, check for altered spinal biomechanics due to a spinal ligament injury. The next step is to give our office a call right now at 757-382-5555. That's 757-382-5555.